Welcome to the Smart Legacy Podcast, your resource for protecting assets and securing your future. Hosted by Stockton and Cant, join us as we cover essential estate planning and elder law topics, such as wills, trusts, and Medicaid planning. Stockton and Cant, your trusted attorney advisors in safeguarding what matters most. Welcome to another episode of the Smart Legacy Podcast. I'm attorney Glenn Stockton, managing attorney for the firm of Stockton and Cant. And we bring this podcast to you to bring you relevant, useful information. If you like what you hear, I would encourage you to like and subscribe. You'll find us on Spotify, YouTube, as well as Apple Podcasts. You can also find past and future episodes of the podcast on our website at stocktonlaw.com. So I'm excited today to have a couple guests in studio with us. So I have here today Brad Hedrick, who is the CEO for Catholic Community Health, and also with us is Tiffany Claire, who is the Chief Marketing Officer. So thank you both for being here today.
Well, thanks for having us.
Our pleasure.
So Brad, you have been with Catholic Community Health for a couple years now, and as the CEO. So tell us a little bit about CCH, as I refer to them as, I may do that as Catholic Community Health, and just a little bit about the services you guys provide and you know, what you guys, what's on the horizon for you guys.
Sure. Well, so I've been in healthcare really my whole life. Grew up in the nursing home business in a small town in north central Kansas and was in sales for several years and was actually a board member of Catholic Community Health. And certainly wasn't looking for any changes, but the opportunity came up for CEO, and really fell in love with the mission and the ministry and what they were all about. And so Catholic Community Health is really relatively young in bringing our home care, hospice, and Villa St. Francis under one umbrella, even though all three entities have been part of the Archdiocese for a number of years, 80 for the nursing home part and 25 for hospice and 30 for home care. It's been just over 4 years since we all came under one umbrella, and that's really what the CEO's role was to unite those three entities, bring them together and provide that continuum of care.
You know, and I think when we had talked a couple months ago, we had met, and you brought up a little bit of just about, you know, it's a little bit of a unique perspective that you guys have when it comes to providing care than maybe other communities may have. And so I think, you know, you mentioned something about the, you know, kind of continuing with the, if I remember right, it was the mission of, you know, Mother Teresa and kind of some things there. So, well,
we are sponsored through the Archdiocese of Kansas City and Kansas. And so we're a Catholic ministry, but as we say, we take care of everybody from A to Z, from atheist to Zen Buddhist, and as I like to say, Mother Teresa didn't ask somebody their faith when she pulled them out of the gutter to provide loving, compassionate care, and so that's what we're all about, and both from a recruiting standpoint for staff members, and you know, some people do come to our organization to receive care or be a part of our ministry because of their Catholic faith, but a lot of them, they just enjoy being a part of our mission and what we're all about.
Well, it's and the things we hear, the level of care that you guys provide is great. And Tiffany is your title is Chief Marketing Officer, but a lot of what it appears, at least from the outside looking in, of what you do is a lot of just community outreach to inform people about the services you provide. So maybe tell us a little bit about what you do and kind of what your mission is in your position.
Yeah, absolutely. So as a Chief Marketing Officer, I help oversee and support our admissions and marketing team at home care, hospice, and also Villa St. Francis. And we go out into the community to other independent living, assisted livings, memory supports, hospitals, parishes, and just try to grow more awareness about our services. There for a while, not a lot of people knew about our home care and hospice, and especially a lot of the churches and stuff. So it's been great to be able to talk about all the different options that they have to be able to help a loved one.
So let's talk about the Catholic Community home health? Like, tell us a bit more about that, and feel free, either one of you, just kind of jump in with that.
So sometimes people get home care, private duty, and home health mixed up. So we provide private duty home care, which is all non-medical. So we do private pay and long-term care insurance, and then we also can do Medicaid as well. So we go into people's homes and we help provide care that, like light housekeeping. We can help with standby assist with showering, bathing, dressing, grooming. We can help take and assist to the doctor's appointments and stuff like that.
Okay. And what kind of geographical area do you guys service with your home health?
We're currently in 6 counties here bordering the state line, and then 4 counties on the Missouri side for both our home care and our hospice.
Okay, very, very good. You mentioned in this too the hospice care you have. So maybe what do people need to know about hospice care? Because I think a lot of people either don't know about it, or they don't know much, and the services that can be provided and how that's paid for, et cetera.
Well, first of all, I think part of our mission is to educate people that hospice doesn't need to be a scary word. It comes with a lot of just negative connotations and what you need at the end of life, and that's really not it at all. It's for those that do have a diagnosis from a physician that their life expectancy is 6 months or less, and it's not just focused on the patient themselves, but also their family. So as a Catholic hospice, the only Catholic hospice here in the Kansas City metropolitan area, we have 3 full-time deacons, bereavement coordinator, pastor, social workers that are really involved with the family as well. So it's not just taking care of the patient, but kind of supporting the family through these difficult times, and also provide palliative care for somebody that's not really qualified for to be on hospice, or maybe they've been on hospice and have improved and need to come off because it is regulated by Medicare and paid for by Medicare, and so they can come off of hospice and go back to palliative care, which just means that they're not seeking extreme, medical measures, for their care.
So hospice care is being paid for through Medicare, which is our insurance we get at age 65 and older. And so are there out-of-pocket expenses for the patient who's receiving hospice care?
No. And we can take people that don't have Medicare. We do have some managed care that we can work with as well. So that is also a benefit as well.
And so with hospice care, you guys can provide that in their homes, but you often have some other alternatives as well. Is that correct?
Yeah, correct. So about 25% of our patients that are on our hospice are in their own home. About 25% are at Villa St. Francis. We have Our Lady of Grace Hospice House within Villa St. Francis, and then about 50% are in other facilities around the geographical area that we cover, which is again the 6 counties in Kansas and 4, and we're growing. But whether they're in independent living apartments, assisted living, memory support, other skilled nursing facilities as well, is about half of our clients.
And then hospice care, I think for a lot of people, the earlier they can seek that, right? I mean, because it can be another set of eyes. It's additional care that they receive. And if they qualify to receive that hospice care, there's no cost for them out of pocket. They're not going to lose assets or anything. So,
yeah, absolutely. I think a lot of people, they think of hospice as a taboo. It's scary, but really hospice is just an extra resource and benefit for the patient and the family as well.
I'll just add that it is kind of frustrating. We hear so often from a family that says, I wish we would have done this earlier. And so you just feel that they missed out on a lot of support and value that they could have appreciated, and again, during a very difficult time.
Well, and that's one of the things I'm hoping that listeners to this podcast will know, that to reach out, at least explore it early. It doesn't mean you necessarily even have to accept the service or move on, but to know what the options are, what services can be provided. We've had clients over the years that have been in hospice for a number of years, and then people think, oh no, it's only in those last final days of life, but not necessarily. Like I say, it can be another set of eyes and that goes on. So it's right here. Well, you mentioned you can provide that at Villa St. Francis. So Villa St. Francis, you're one of the largest communities in the state of Kansas, and I want to say the largest facility with Medicaid in the state of Kansas. Is that correct?
Yeah. So Villa St. Francis has been around for about 80 years. We moved to the Olathe location back in '95, and so we have short-term rehab, long-term care, and skilled memory support. And so we are licensed for 170 residents, and so about, what would you say, 75% are Medicaid. And so thanks to you and your team, we're able to partner with you guys to help some of our residents divide assets or help get Medicaid pending. So that's really helpful. I think, since we are Medicaid pending, we're one of few that do accept Medicaid pending. And so what that looks like is we could have anywhere from 10 to 20 residents on Medicaid pending. And if you look at the care cost, it's about $350 a day. And then it can take anywhere from 2 months to 12 months, if not longer, to get approved for Medicaid. So we're providing free care to all the Medicaid pending residents. And so it's $350 a day times 30 times however long it's going to take to be able to get approved for Medicaid.
So as a reminder, listeners, Medicaid, people get Medicare, Medicaid confused. We talked about Medicare. That's our insurance at age 65, pays for hospital visits, doctor, visits, hospital stays, prescription drugs, helps with the hospice care. But Medicare is not going to pay our long-term care costs, right? If we need to move into assisted living or into skilled nursing care, other than for up to a maximum of 100 days for rehabilitation purposes. So Medicare is not going to pay for that, but Medicaid can, but we have to qualify. So I want to dive a little deeper into this Medicaid pending, because a lot of people may say, well, what do we mean Medicaid pending? Right. Because that can be so helpful for someone who accepts Medicaid pending for families that move in, because Medicaid does not necessarily move really quick on approving these things. It takes time once an application is submitted. So if you could maybe go a little deeper, when we talk about Medicaid pending, what is that? What does it mean? And how does that benefit the person who is in the families that are receiving care?
Well, we're one of the few facilities that does accept the Medicaid pending, because as Tiffany just described, it's a long process, and sometimes somebody might not even get approved, and therefore you provided free care for, it could be months or a year. But our philosophy and part of our mission and our ministry is to make sure that just because somebody doesn't have the ability to pay out of their own pocket, they shouldn't not have access to quality health care. And so, a lot of people think that, well, if I need the care, the government will just take care of me. But like you mentioned, Glenn, the process can take time. And so it's pretty comprehensive as far as the application and looking at the financial information. And there's even a division of assets to protect a well spouse so they can remain in their own home. But it does require the family to provide the necessary information to move that process along. And
but it's so helpful to have that where Medicaid pending, where it removes that level of stress of how we're going to pay for this. And so for people that obviously it looks like, okay, we're applying for Medicaid and this is going to be approved to go in. I think it's great. Another thing that strikes me, I'd like you to maybe talk a little bit about is, what it's like. So if we move into Villa St. Francis, again, this is people are thinking, oh, this is, my last resort or whatever. but not necessarily for a lot of people that are going earlier, and it, it's a vibrant lifestyle. So maybe talk a little bit about what resident life at Villa St. Francis is like.
Yeah, so Villa St. Francis, we're actually 5-star. We're rated by Medicare.gov. And so a day in life of a resident, we have daily mass from 10 to 10:30. We also, you don't have to be Catholic to go to mass. We also provide non-denomination services as well and Bible study. We also, in the evening from 3 to 11, if you are Catholic, we do have about 12 to 15 nurses and aides that are sisters, they're nuns, and they've been with us for quite some time, like 2005 or so, that provide great care. We have a full-time priest, Father Carl Good, that's there as well, he's so much fun. He'll do activities with the residents. He'll go and sit with them and talk to them, do different activities. And so he can also do, towards the end of life, last rites and stuff as well. So you want to add anything?
Well, I think, again, a lot of times people have that negative perception of long-term care. And I think what people miss out on a lot is just the psychosocial well-being. I mean, we have a pretty robust activities department, so rather than sitting at home by themselves in the dark, with the TV on the same channel, there's a lot of social interaction, a lot of opportunities to participate, and it's kind of like hospice that I wish I would have done this earlier. We've had families say, these were some of the best years of Mom's life. I mean, she made new friends here, but that the acuity level and the needs of residents has increased so much in the last 10, 15, 20 years that really what we're doing today was what was done in hospitals not long ago, and what assisted living facilities are doing is what nursing homes were doing 15 years ago. So.
Yeah, and it's fun to hear from families that, that their loved one was at home and then they come to Villa and they get that spark back in their eye again. So it's great to hear that and then just see all the testimonies that they tell us about. So.
Yeah, and I think that's one of the things that strikes me is the activities that are available to them, and that they can kind of regain this vibrant lifestyle to be able to do things with other people, and the social interaction and those that go on.
And Kansas should be proud. I mean, we were the first state to really try to change the culture of the nursing home industry, and just really focus on resident choice. I mean, back when they first started in the 70s, I mean, they were institutional care, and we've really kind of taken away the medical model, and we say, they might not be good choices, but it's the resident's choice. I mean, if they're a brittle diabetic and they're at home and they want chocolate cake, they're going to have chocolate cake. I mean, we shouldn't take that away from them. So what time they get up, what time they go to bed, what activities they want to participate in, it's all about their choice. And sometimes it's kind of hard, and I've even talked to families like, I mean, we're not the shiniest nickel out there, right? I mean, we're an older building, but there's something different. Sometimes words can't even describe really when you're in Villa. And, we're one of the most highly regulated industries in the world. And I think data is important. And sometimes it doesn't tell the whole story, because I really think you need to make decisions on your family or your loved one's care really by physically visiting the facility and making decisions with your eyes, your ears, your nose, and your heart. And we got some good news yesterday to share with our Clinical Excellence Committee, which is made up of board members and then our clinical team, that we're ranked 363rd out of 13,900 facilities in the country. And so the top 3% on really 4 criteria of rehospitalizations, infections that caused a hospitalization, staffing hours, and staffing turnover. And so it is a special place. It really is.
Congratulations on that.
Thank
Thing, Tiffany, you brought up that 5-star rating that you rated
Mm-hmm.
5-star in Kansas. So maybe if you guys could talk a little bit about what is the 5-star rating, why is this important? What should people look for? I mean, why does that matter to someone who's looking at options of where to either go themselves or to place a loved one?
So you can get on Medicare.gov if you're looking for a long-term care facility, and then just type in the facility and what city it's in, and then it'll guide you through what was their health inspection like, what's their quality care like, and it'll rate from 1 to 5 stars. So obviously 3 to 5 stars is probably the best. And so you can do this on the Kansas and Missouri side as well. But I would say if you're looking for a facility for a loved one, kind of like what Brad said, just go in, see what the energy, the atmosphere is like. Ask about longevity of staff. How long has their director of nursing been there? How long has their administrator been there? Do they use agency? We're very blessed not to be able to use agency. So all of our team members are ours. And so they know our residents very well. They know what time they want to get up. They know all their little quirks and what they like, what they don't like. So that means a lot as well. When they go into tour, what do the residents look like? Are they clean? Are they happy? Are they smiling? Can you find staff? There's facilities I've been into that I'm trying to find someone to talk to, and it's kind of like a ghost town. You come to Villa, and that's definitely not what you'll see. You'll have people asking you, can I help you with anything? Or how are you? So you'll get that feeling of like, oh, it might be a beautiful community or facility, but, how are they going to care for your loved one? Are they going to, check the call lights? Are they having a bad day and not going to care for your loved one? Very nice. So, I mean, it's just good to go in and get the feel, and you'll definitely get that feeling for sure.
I think one of the important numbers is looking at that staff to patient ratio,
Mm-hmm.
and is there enough care to go in? So, I mean, those things are so important to the quality of life and quality of care that families preserve. So, again, congratulations on the news yesterday, as well as the 5-star
Thank you.
rating, which I think is so important. So you brought up, going touring, looking at places. So, what advice would you have for people in that regard that want to come see, but not only Villa St. Francis, but if they were looking at other choices, what are they, besides the things you talked about? Are there other things they should look at, or how would they go about scheduling this?
Well, it kind of puts us on the spot, but just being an advocate my whole life for our industry is I suggest people go in unannounced.
Mm-hmm.
I mean, go in on a weekend. A lot of facilities don't have the same staffing ratios on the weekend as they would during the week, but and it's fine to have an appointment, but I think it's maybe just because of my experience, but you kind of know right away the vibe, starting from the admissions coordinator and how you were greeted, and just that feeling that you get. And like Tiffany said, I mean, we might not have a $15,000 chandelier in our front lobby, but if you walk around Villa, you'll I think you'll get that feel that, again, words can't describe, or a fancy brochure can't illustrate, or a fancy website. It's really walking around and seeing the interaction with the staff and the residents.
Yeah, and I would also recommend, like, if you are on a tour, if you do see staff members, ask them how long they've been there and why they enjoy working there. I think that's big because, again, if you can come to Villa, you can see a majority of ours have been there 15 to 30 years. We have a housekeeper that's been there for over 40 years, and they can tell you why they enjoy working at Villa and taking care of our residents. So that's a big one, I think, too.
And we, as an organization, put a lot of emphasis on our culture. I mean, we have almost 400 team members, and one of the biggest testaments is those that have left and come back. So, I mean, we do appreciate that, the dollar is important. But sometimes when they have left to do something for an extra dollar an hour, they come back. And it's not just the staffing ratios, but it's the appreciation, the leadership within the building. And just today we're doing a tailgating party for our staff and giving everybody new T-shirts to kind of kick off the Chiefs new season. So just a lot of smiles around the place. It's pretty incredible.
It's neat. I grew up in the nursing home business of the 70s and 80s. As you said, there's been a lot of change happening, but my mom had been a nurse. She'd worked in the hospital setting as a respiratory therapist, went into, worked in a couple nursing homes, and then eventually left the nursing and became an activities director. And her job was to make life as pleasant as she could for residents. But you walk in to these communities and see, within your community, the vibrant lifestyle that these people can live. And it really is, you see the difference of how things have progressed. So that kind of leads me to this. What are, in your guys' view, the top 3 misconceptions people have about Medicaid and about long-term care in general?
I could say for Medicaid or even Medicaid pending, I think people have that perception just because you're on Medicaid or Medicaid pending that you've always been poor and you've never had money, and that's not the case. We see at Villa that we have doctors, lawyers, attorneys living at Villa, and they had to go Medicaid pending just because they ran out of money. They could have been living in independent living or assisted living. And we all know it can be a little expensive, so they just ran out of funds, and or they sold their house and used up all those funds as well. So I think just the misperception of what Medicaid looks like, because I think at one time or another we all might be there.
And I think, for people to plan early. Because, we don't have to go through all the money, right? And why is that important from our perspective as elder law attorneys? We're trying to help people protect assets and preserve them. It's not necessarily just so we can pass them on to the next generation, but Medicaid's not going to pay for everything you might want, right? They pay for everything the state says you need, but so having money to supplement care, having money for that other spouse that's coming in. But if we've had to go through spend everything, because Medicaid will require you to spend everything to have nothing. So if we can do that planning early to protect it and supplement the care, and so that requires this team approach between the community, the attorneys, and that. Brad, CEO, there's a lot of changes going on in this community. We've heard a lot in the news, with the one big beautiful bill that was passed, and cuts to Medicaid. And that, how, if at all, is that affecting things from what you can see so far? Are you seeing any effects of that?
Well, there's still some unknowns out there, but as Tiffany mentioned, we're 75% Medicaid. Usually, historically, we've been 80% or above, and so any cuts to the Medicaid system in Kansas would be devastating for us. I mean, as a 501c3 and being a part of the ministry under the Archdiocese, I mean, we do rely on fundraising and donations and support to be able to cover the deficit, because Medicaid never has and never will cover all of our costs. So we know we're going to be operating at a deficit every year. It's just a matter of how much we need to make up.
And as we're all trying to work through this tax bill, and it appears what I've worked through so far that most of the cuts at least are aimed at, not that population who's receiving care in nursing home, because Medicaid's such a huge program. It's more aimed for people that the government deems might be really still able to work and help pay their costs. But, we'll see how it all flows out. But one of the things that is somewhat concerning is when we do start making cuts on that, is staffing levels within the Medicaid offices themselves. If we see cuts there, we're already seeing long, processing times often in this, and they're doing their best, as they try to work through these things. But as they cut staff, that can help in turnover within those offices where you have new people coming in. So, yeah, I think we're just going to have to wait and see kind of what happens with this. But you guys have been doing this long enough to know it's the ebbs and flows of this, and you work through. But we'll see and go on. What do you have planned? What do you see for Catholic Community Health and as a whole? And I know that encompasses a lot, but over the next 5 or 10 years, is there, what do you see changing or what's on the horizon?
Well, I think it's important to do what we currently do great, but always look at ways that we could add to our continuum of care. So from home care, hospice, Villa St. Francis, Tiffany described how home health is definitely different, but there's other parts of the continuum of care that we're not in that might be viable options, but definitely is the geographical growth throughout the Archdiocese of Kansas City and Kansas, and then the Diocese of Kansas City St. Joe is growing to be able to provide a bigger geographical area of services. And the home care, as we talk about the silver tsunami and all the baby boomers and that, and people thinking, well, there's not going to be enough nursing homes. I mean, our industry's changed so much, and there are, we've talked about why some of the benefits of living in a nursing home. Our philosophy is also there is benefits of staying at home, especially if that's what somebody wants to do and it's safe for them. And so we currently have over 350 clients on our home care. And so a large number of those are private pay or long-term care insurance. And we've worked with the state in trying to get those Medicaid rates changed, and we've been successful in moving that number up to allow us to, again, provide quality care to those that can't afford it themselves. So again, as a Catholic ministry, it's important that we give access to quality care to those that can't afford it. So I think the home care, the home health parts of our side, we saw it during COVID where people were doing skilled home health in their own home. That's really where I see our emphasis is continuing to grow our home care. The hospice, again, I think it's educating people on really what hospice is and what it isn't and why it shouldn't be scary. Talking about death and dying isn't comfortable for everybody, but we all have one thing in common. We are all going to die, and so it's a matter of, again, planning, talking to your family about that, and figuring out what is important to you, not waiting, so you're less likely to have more influence on that decision.
And I'll add to that too. So something that we've added this year as part of our growth is our care navigator. So we have a care navigator that goes and visits all of our home care clients, and then when they go to the hospital or rehab, visiting them and figuring out what's the next step for them. Can they go back home with private duty home care? Are they looking for an assisted living, long-term care, memory support? Like, what's the next step? And we can also provide this service to people who aren't even on our services. So it's just a great service to try to navigate healthcare, because it could be so overwhelming, especially when you are in the hospital and, discharge planners are just giving you a list of places to go and not really helping you navigate through the system. So we have Victoria, who does a great job. She's been with us since January, and we've seen great growth and just helping more families navigate through the system. And we receive a lot of emails just thanking her and all the services and stuff that she's helped them find.
That's really, I didn't realize you had that. That's again one of those changes just from looking back to, I spent a lot of time in there with it when my mom was working there and just seeing it change. Right. Well, Brad, you had mentioned you guys are a 501c3, right? And that Medicaid does not cover all the costs of these things, and it never will. So you guys have a fundraising event coming up, as I understand, which is called Fall Ball. I think it's on October 4th coming up. So tell our listeners a little bit, what is Fall Ball, what's its purpose, mission, and why should they get involved?
So Fall Ball is, this is actually our third annual Fall Ball, and we're grateful that you guys are a pro sponsor with us as well. So thank you for sponsoring this year and last year. So Fall Ball, we started it because, as we've talked about, Villa St. Francis is one of the largest nursing facilities that accepts Medicaid, and so in the Medicaid pending piece, where we talked about 15 to 20 residents on Medicaid pending, and so those services are provided for free. So this Fall Ball helps supplement some of that shortfall, so we are still able to provide the 5-star quality care to all of our residents. Did you want to add to that?
I mean, it's our annual Super Bowl, and so I mean it's designed to really generate about half of the annual shortfall that we need covered. So this year we were shooting for 550 attendees. Last year was 490. So it's really generated a lot more awareness about our ministry and created some momentum. But it's a great night at Fiorella's event center. It's a great meal. Have a couple great speakers. Dr. Tim Grave, that started the Augustine Institute and formed.org, is one of our keynote speakers, and then a local mentor to a lot of Catholic men, Rich Henry. We're going to honor him. And he's had experience personally with Villa, with family members, and really wants to share his story.
And who can attend?
Everybody. Anybody.
Okay. And so they come in, it's at the Fiorella's Event Center over in Park, 135th and between Antioch and Schweitzer, if I remember
coaches,
right.
Yeah,
behind the coaches there. So great facility to have this at. And so there's going to be dinner, speakers, be a fun night. Just something people typically get dressed up for. And
it's cocktail attire. And if anybody is interested, they could go to our website at catholiccommunityhealth.org and then /Fall Ball. Or you can even just Google Catholic Community Health Fall Ball, and it'll pop up.
And again, that's on October 4th. So yeah, I'd encourage people, to check that out, to attend. You're supporting a great cause, and you're going to have a great time that evening doing so. So, all right, couple questions as we're kind of ending our time here. If you had 60 seconds to tell families why Catholic Community Health should be their first call, what would you say?
I think quality. I mean, like I said, if it's Villa, I mean, it kind of depends, I guess, also on which part of it, if it's whether it's home care or skilled nursing or hospice. But, as I try to say, I mean, Catholic healthcare and quality healthcare should be synonymous. And so we're proud to be a Catholic organization, but we're as proud to really provide quality care, and not just for those that we serve, but their loved ones, their family members that need our support.
Right. And I think too, as we talked about, people don't think that they have a choice in their health care. So a lot of times when they are in the hospitals or rehab hospitals, they're just handed a list. And so if somebody who is Catholic or has heard about us and our services and our quality care, I just really encourage them to tell their social worker or their case manager, I want Catholic Community Health, if that's home care, if that's palliative, hospice, or Villa St. Francis, just that everybody has a choice. And so I think a lot of people don't realize that.
And if somebody wanted to reach out to get a hold of you guys to learn more or to tour Villa St. Francis or learn more about any of these, how would they best go about doing that?
I would say just go through our website at catholiccommunityhealth.org. And then that has all of our different entities on there for home care, for hospice, and for Villa St. Francis.
All right. Well, guys, thank you for being here today and taking the time. This has been fun, and I've learned a few things as well. Congratulations again on the news. You should be being the top 3%. I think that's a big deal coming in right here in the Kansas City area. So for listeners, thank you for tuning in. Again, this is the Smart Legacy podcast, and I encourage you, if you find this to be useful, relevant, like it, subscribe, and again, you'll find us on Spotify, YouTube, Apple Podcasts. So we encourage you to tune in to future episodes, and hopefully you found what we talked about today to be useful and relevant to your care. Thank you for tuning in.
The information provided in this podcast is for general informational purposes only and does not constitute legal advice. Listening to this podcast does not create an attorney-client relationship. Laws vary by state, and this podcast focuses on estate planning and elder law in Kansas and Missouri. If you are located in Kansas or Missouri and require legal advice, please contact our office. Otherwise, consult a qualified attorney licensed in your jurisdiction.